COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, working life and stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Joining us today on the show is Dr. Sunil Kumar Mishra, MD DM Endocrinology, Director Endocrinology and Diabetology, Medanta Medicity Gurgaon, Dr. R Kumaran, MD Consultant Physician, Apollo Hospitals, Madurai, and Dr. Sumanta Chatterjee, MBBS Honours Gold Medalist, MD Medicine Gold Medalist, DM Cardiology, FSCAI, AFESC Consultant, Interventional Cardiologist, AMRI Hospital, Kolkata. Thank you all so much, doctors, for joining us today. I would like to start with you, Dr. Mishra. Do medicines that are used to treat viral infection cause hyperglycemia or high blood sugar, if I can put it that way? If yes, then after getting cured of the infection, do blood sugar levels come back to normal, or do they need medication to reduce them at some point?
So regarding viral infection in the sugar, any infection, including viral infection, may increase the sugar as well. So we have to be a little bit cautious about that. Second context may be the steroid causing the high sugar, and as we know recently during the treatment of the COVID-19 related infection, the steroids being used either by the oral route or the intravenous route, which has definitely resulted high sugar, especially in even the people who are not having the diabetes, and those who are having the diabetes, the sugar levels really went very high. The third reason may be some viral infection can cause damage to the pancreatic beta cells, and these cells secrete insulin. So damage to those cells will definitely result into high sugar, and some of them may develop permanent diabetes as well. And that has also been documented during COVID-19, where a new onset diabetes because of the pancreatic insulin deficiency being reported by COVID-19 related infection. Finally, and the most common condition is that more than 50% of the individuals are unaware that they are having diabetes. So we may be picking up those people during the viral infection, and we know about their diabetes status.
Dr. Kumaran, we have learned many things due to this pandemic. The importance of immunity is one of them. How does immunity vary in people with diabetes?
People with diabetes are immune suppressed because of high blood sugar, which can act on the immune responses of the patient. Thus, they are more prone for certain infections, especially of the lungs, like tuberculosis, the skin infection, and urinary tract infection. This type of immunosuppressed state can lead to the patient's deterioration in health condition. And there are certain nutrients which can be added to the daily diet, which can improve the immune responses, especially certain products like nuts, certain fruits, certain vegetables, etc. And this type of addition to the nutrients, the diet can improve the immune response and also keep the HbA1c in target.
Dr. Chatterjee, COVID-19 causes viral pneumonia with additional extrapulmonary manifestations and complications. What are the intermediate and long-term consequences of COVID-19 infection on the cardiovascular system?
COVID-19 infection mainly producing viral pneumonia in a respiratory system, and definitely it produces a few complications or consequences in cardiovascular system. What are those systems? What are those complications? Arrhythmia, dysrhythmia, that is low pulse rate, high pulse rate. Patient is having sinus bradycardia, sinus tachycardia, atrial fibrillations, QT prolongations, 2:1 heart block, first degree heart block, 3:1 heart block, even complete heart block. We did a pacemaker in 10 patients in COVID-19 infection in this last 2 years. We do not know that it is a direct effect of this viral infection, or patient is having a complete heart block unmasked during that period incidentally. And blood pressure fluctuation, blood sugar fluctuations, these are happening rampantly. Many a times patient is having hypotension, or we have to add medicines or antihypertensive medicines to bridge the gaps. And some coagulation malformation. What are those? Deep vein thrombosis in our legs and acute lung attack, that is acute pulmonary embolism. These are devastating consequences of COVID-19 infection. These are all immediate or intermediate consequences and complications in cardiovascular system. It will be premature to comment about the long-lasting effect of COVID-19 infection in cardiovascular system. We need a couple of years to see what are the long-lasting effects.
Dr. Mishra, tell us, how does the prevalence of type 2 diabetes mellitus differ among racial and ethnic groups? Is it true that we as Indians are more prone to getting diabetes?
We are aware that people with Asian race, African Americans, Paima Indians are at high risk of developing diabetes. Coming to Indians, we Indians are prone for diabetes for various reasons, and this is no question, there is no question about this thing. Because of the increased fat, especially the central fat, abdominal obesity, decreased beta cell reserves, the cells which secrete insulin, decreased muscle mass. For any Caucasian race, we have decreased muscle mass, so that means we have more fat, less muscle. Decreased physical activity, we are not tuned to do physical activity, and increased carbohydrate intake in our diet. The most worrisome trend, what we are seeing recently, is that the younger and younger individuals are developing type 2 diabetes. Therefore, these individuals are more prone for the long-term complications related to diabetes, as they are staying with this bad environment of dysglycemia and metabolic dysregulation for longer duration.
Dr. Kumaran, if an individual has diabetes, what all approaches can help maintain target glucose levels? Insulin or oral medications? What is the better approach?
Whatever be the treatment strategy, it should all start with a diet control. A good dietitian should advise the patient about the calorie intake, the protein intake and carbohydrate intake. Plus, number 2 is physical exercise. Daily walking for at least 40 to 50 minutes is very essential to keep the blood sugar near target level. There only comes the role of medication. There are various types of medications like sulfonylureas, metformin, and SGLT2 inhibitors, and gamma agonists, etc. This act through two mechanisms. One is there are drugs which improve the insulin resistance, which is very common in Indian patients, and there are drugs which improve the insulin secretion from the pancreas. Both these type of drugs are needed to maintain the glucose under normal level. Apart from that, insulin comes as the next stage when the patient has got still uncontrolled diabetes, and if HbA1c target is not achieved, then we start with insulin. Well, type 1 diabetes patients are mostly insulin requiring, and they start insulin as soon as it is diagnosed.
Dr. Chatterjee, what are some of the signs in the young population that one should look out for to know in case there is a problem with the heart and may need to visit a doctor immediately? Because now we very often see that the youngsters are getting heart attacks.
Yeah, this is a very pertinent, important question that in last couple of years, we heard news that this youngster, a sports person, actor, having a good physique, died due to heart attack or a sudden cardiac arrest, sudden cardiac death. So the youngsters around 35 years of age, 40, 45, 50 years of age should be very cautious, and we should know what are the cardinal symptoms of heart diseases. What are those? Heart, chest pain. This pain may be excruciating. This pain may be mild variety of pain. That is central chest pain, going to the left arm or right arm, in the jaw, especially when you are exerting, walking, talking, or running, along with sweating. This is extremely important. If you are having this kind of symptom, definitely go to your doctor. Next, respiratory distress. If weeks back, I don't have any kind of respiratory distress, but now if I go up to 2 flights of stairs, I am panting, palpitation, pedal swelling, and syncope, that is blackout, sudden loss of consciousness. So if these we are experiencing even a single time, do not waste your time. Go to your doctor, get thoroughly checked up, and get yourself diagnosed. What is happening out in your body system, especially cardiovascular system, because we know that it may not give time. These cardiovascular system events, you have to be very cautious from your early age.
Thank you so much. That was a very important point that you've put out there. On that note, we're going to be taking a short break. We'll be right back. Welcome back. You're watching Beat Diabetes, Myths versus Facts. Starting with you, Dr. Mishra, are gestational diabetes and preeclampsia related? Do preeclampsia or gestational hypertension increase the risk of postpartum type 2 diabetes mellitus?
Preeclampsia is a condition where a lady is being detected with high blood pressure first time in the pregnancy, especially during the second trimester, associated with the high blood pressure and its adverse effect in the pregnancy. Gestational diabetes is again the condition where high glucose level is being detected for first time during pregnancy. The common factor between these two conditions may be the insulin reserve. Therefore, the ladies with gestational diabetes are at high risk of developing high blood pressure during pregnancy, and similarly the lady with preeclampsia are also at higher risk of developing gestational diabetes mellitus. And there is a complex interplay of the risk factor between the two. Regarding the long-term effect of gestational diabetes and preeclampsia for long-term permanent diabetes, so preeclampsia, there is a modest increase in the risk of the long-term diabetes is there. Gestational diabetes, we are well aware that people in Asia, ladies in Asia who develop gestational diabetes are very high risk of permanent diabetes in coming 3 to 5 years. That may be up to 50%. And if both these factors are present, definitely risk further goes high. Therefore, we need to follow these ladies with the gestational diabetes and preeclampsia for occurrence of the long-term permanent diabetes.
Dr. Kumaran, we all know that smoking is an important risk factor for cancer and heart disease. Can smoking also cause an increase in the risk of diabetes? Is there a connection?
Smoking and diabetes is an important problem because smokers can develop diabetes. Nearly 40% of smokers develop diabetes even otherwise. The smoking also increases the diabetic patient's complications like heart attacks, like peripheral vascular disease, because of the vasoconstrictive effect of the nicotine and the bad effects of smoking. Not only that, it also causes the increase in the lung infection can also lead to lung cancer, not only diabetes. But hence, when you see a patient with type 2 diabetes and who is a smoker, the first thing we have to do is to insist him on this, giving up smoking or giving up even other tobacco in whatever be the form, so that his health can be improved. He will have a better quality of life and with other treatments for diabetes.
Dr. Chatterjee, how can you define elective surgery in the field of cardiology? Are all heart surgeries essential and on an emergency basis, or in a few cases we can wait till the pandemic condition improves? What do you suggest?
This is also a very important question. So in cardiovascular surgeries are not exceptions. It has two spectrums, that is elective planned non-emergency surgery and some urgent surgery. But it depends on the indication of surgery, what the disease is. So cardiovascular surgery means two things. One is done in cath lab, that is you can call intervention, cardiac intervention, that is pacemaker, angioplasty, some device closure, and open heart surgery, that is CABG, cardiac bypass surgery, valve surgery, heart hole surgery, pediatric surgery, the ASD, VSD, PDA closure. So if the patient is having heart attack, that means you have to go right now to make him survive, number one, and to give him a heart failure free life in future. If this is the goal, definitely this is an urgent surgery. Nothing can wait here. So in these cases, we put the patient immediately in the cath lab. more earlier, more the benefit patient will get. This is called angioplasty, primary angioplasty. Second is pacemaker implantation. If the patient is presenting with 2:1 or 3:1 heart block, that is complete heart block, we put a temporary pacemaker and put the patient in cath lab to do a permanent pacemaker. So these things cannot wait. Apart from this, if your surgery is like you are having a triple vessel disease and you should go for a bypass surgery, or you are having an aortic valve or mitral valve disease, you should go for a valve surgery. This can wait. Definitely, it's a planned one. This can wait.
Dr. Mishra, diabetes causes many severe complications. We all know that. But tell us, does diabetes affect the gastrointestinal system as well?
People with diabetes do develop gastrointestinal complications. Risk factor for those complications are long-standing diabetes, autonomic dysfunction, drugs being used for the treatment of the diabetes, and there may be some associated disorder along with the diabetes which may result into the complication at gastrointestinal system. The presentation of those complications may vary from esophageal disorder, which may result into reflux disease, the acidity, belching. In terms of the stomach problem, it may result into early satiety. People will start complaining about early satiety or early fullness after eating even a small portion of the meal. It may result into intestinal disorder where people will complain about alternating diarrhea and constipation, or sometimes diabetic diarrhea is a presentation may be there. The non-alcoholic fatty liver disease you must be aware about now. It's a common condition being seen nowadays with the diabetes and even with the overweight and obese individual. So there are variety of these complications do present in the people with the diabetes, and we need to be aware about that and address it accordingly.
Dr. Kumaran, we do know that diabetes comes with a number of complications. We've been discussing that. But tell us, can diabetes affect a person's memory in some way?
Patients with type 1, type 2 diabetes mellitus have been found to have a decline in the cognitive function, that is, the memory loss. Especially type 1 diabetes patients are more prone for memory disturbances or cognitive decline during the course of the disease. Whereas type 2 diabetes patients, when they have got very uncontrolled blood sugar levels, can lead to decline in the cognitive function. But this can be reverted by proper control of diabetes, keeping the blood sugar in the near normal value and keeping the HbA1c at the near normal value. This cognitive decline can be averted and they can live as normal as any other person with normal memory.
Dr. Chatterjee, lockdown has disrupted the routine of people. People have missed routine blood tests and other health-related tests. Can you please advise patients which tests should people do regularly to keep a check on their heart health?
These can be categorized into spectrum. One is patient is already diagnosed to have cardiovascular disease. That means patient is having bypass surgery, patient is having angioplasty, patient is having heart failure, any heart valve surgery, even stroke. This is one spectrum. Another is patient is not having any cardiac ailments. Patient is not having even a risk factor for cardiac disease like hypertension, diabetes, smoking, obesity. So in these two categories, the tests are more or less same, but the frequency or interval with which you should have these tests may differ. If you have heart disease, definitely you should do these tests regularly at the interval of 3 months or 4 months or 6 months and visit your doctors. If you don't have these risk factors, after you cross 40 years of landmark, do regular health checkup once in a year and get checked up by your doctor. What are the best? ECG, simple ECG, echocardiography, one complete blood count, urea creatinine, that is renal status, thyroid, cholesterol, lipid profile. So these are, and sugar test, fasting and HbA1c. So these tests, this is the basic primary test by which we can pick up whether you are suffering from any risk factors for cardiac disease, or we can diagnose you are having any cardiac disease. So these are the tests. Yearly, if you don't have any symptoms, or every 3 months or 6 months, you have cardiac ailments, and your doctor, of course, will decide.
Thank you so much, doctors, for all your credible information which you've put out here. And I'm sure that our viewers have definitely got some insights from here. Thank you all so much once again.